This conference will now be recorded.
Hi everyone, and welcome to Mental Health Monthly with Sally Starr, Mental Health Program Coordinator for City of Manassas Park. This month we're going to be talking about substance use. So again, there's a few ways to participate. We do hold these virtually through GoToMeeting. The link is available on our PowerPoints on our website, as well as on the library social media pages. Each session is also recorded and posted at manassasparkva.gov under the mental health page. So as always, I like to start out with what is mental health. So we all have mental health, and looking after our mental health is just as important as looking after our physical health. And mental health refers to the maintenance of successful mental activity, which is maintaining productive daily activities, maintaining fulfilling relationships with others, and having the ability to adapt to change and cope with stress. It's all about our feelings, our thinking, our emotions, and our moods. So substance use is the excessive use of a drug in a way that is detrimental to self, society, or both. Addiction is a primary chronic disease of brain reward, motivation, memory, and related circuitry. Dysfunction in these circuits lead to characteristic biological, psychological, social, and spiritual manifestations. This is reflected in an individual pathologically pursuing reward and or relief by substance use and other behaviors. So substance use disorders, what does that entail? So to start with, both legal and illegal drugs can be abused. Addiction is a disease. It means you cannot stop using even when your condition causes you harm. It's a physical and psychological dependence on a substance. Generally, it's diagnosed on a continuum from mild to severe. Mild substance use disorders in the DSM-5, which is the Diagnostic and Statistical Manual of mental health disorders, requires 2 to 3 symptoms from a list of 11. So the more symptoms you have, the higher on that continuum that you would be. Gambling disorder is also grouped with substance use disorders. There are similarities to addictive substances and clinical expression of the brain origin, comorbidity, physiology, and treatment in gambling disorders. So there are different drug classifications. So the first one is stimulants. These are medications that increase alertness, attention, energy, blood pressure, heart rate, and breathing rate. Short-term effects include increased alertness, attention, energy, increased blood pressure, and heart rate. Long-term effects can lead to heart problems, psychosis, anger, and paranoia. The next class is central nervous system depressants. So these are medications that are going to slow our brain activity, which makes them useful for treating anxiety and sleep problems. Short-term effects include drowsiness, slurred speech, poor concentration, confusion, dizziness, problems with movement and memory, lowered blood pressure, and slowed breathing. Long-term effects, there are still studies being done to identify the specific long-term effects of this drug classification group. Another classification is hallucinogens. So these are substances that distort the perception of reality. Short-term effects are increased heart rate, nausea, intensified feelings and sensory experiences, changes in sense of time. Long-term effects include speech problems, memory loss, weight loss, anxiety, depression, and suicidal thoughts. So different types of substances that fall into those drug classification categories. There's opioids, which are like heroin, morphine, fentanyl. Fentanyl is actually 50 to 100 times stronger than morphine. Hypnotics and sedatives, barbiturates, diazepam, which is Valium, Xanax, Ativan, Ambien. Stimulants, amphetamine, cocaine, MDMA, which is Molly or ecstasy. Hallucinogens, LSD, PCP. There's volatile hydrocarbons, so this is going to be gasoline, paint thinners, cannabinoids, marijuana, hashish, alcohol, and tobacco. So here are just some facts about new users introduced to drug abuse each year. So in alcohol, first-time users in a year is 4.9 million. Marijuana, there's 3.1 million. painkillers 1.9 million, tobacco 1.8 million, hallucinogens 1.1 million, cocaine 874,000, methamphetamine 205,000, and heroin 117,000. So let's talk more specifically about alcohol. Alcohol affects everyone differently. Drinking too much or too often can increase your chance of injury or accident. Heavy drinking can cause liver or other chronic health problems. So for men, what that means is more than 4 drinks on any day or more than 14 in a week is considered over drinking. For women, it's more than 3 drinks in one day or 7 in a week is considered over drinking. 1 drink is considered 12 ounces of a regular beer, 8 to 9 ounces of malt liquor, 5 ounces of wine, or 1.5 ounces of distilled spirits. Alcohol withdrawal. So drinking heavily for weeks, months, or years may have mental and physical problems, may lead to mental and physical problems when you cut back or stop. So symptoms can range from mild to serious. Let's think back to that continuum of substance use again. Alcohol has a depressive effect on your system and changes your brain functioning. So time frame, 6 hours after you stop drinking, you may experience anxiety, shaking hands, headache, nausea, vomiting, insomnia, and sweating. 12 to 48 hours after you stop drinking, hallucinations, seizures. 48 to 72 hours after you stop drinking, confusion, racing heart, high blood pressure, fever, and heavy sweating. Next one we'll go over is marijuana. So a growing number of states have legalized medical uses of marijuana and recreational uses of marijuana. Marijuana can make you feel silly and laugh for no reason. You may feel sleepy and forget things that just happened. It is believed to impair short-term memory, causing difficulty learning and retaining information. It can impair your motor coordination, so driving while high is considered just as dangerous as driving while impaired by alcohol or other drugs. Symptoms of marijuana withdrawal include diminished appetite, mood changes, irritability, sleep difficulties, headaches, loss of focus, cravings for marijuana, sweating, chills, and stomach problems. Next one we'll go over is tobacco products. So nicotine, vaping, cigarettes, chewing tobacco, things like that. So these contain nicotine that provides a rush of pleasure and energy. Nicotine is considered a stimulant, and the common side effects are decreased appetite, heightened mood, increased heart rate and blood pressure, nausea, diarrhea. And then it does come along with some better memory and increased alertness temporarily, irritation and burning sensation in the mouth and throat, increased salivation, nausea, and abdominal pain. The effects wear off fast and leave you wanting more. Nicotine is considered one of the most toxic of all poisons and one of the most addicting agents. Nicotine withdrawal includes nicotine cravings, anger, frustration, irritability, difficulty concentrating, insomnia, and restlessness. It can be accompanied by anxiety and depression, hunger or increased appetite, persistent cough, stress, and sleep disturbances. Up next, we're going to talk about prescription and over-the-counter or OTC medications. So again, these are just as dangerous and addictive as illegal drugs. Even being prescribed by a doctor, they still have addictive tendencies and should be used as prescribed. It is considered abuse if you take medicine prescribed for someone else, you take extra doses or use a drug other than the way it is supposed to be taken, which is the way your doctor prescribes it, or if you take the drug for a non-medical reason, such as to relax or to enjoy your day, something of that nature. Long-term prescription stimulant misuse can increase the risk of psychosis, anger, paranoia, heart, nerve, and stomach problems, and can lead to overdose. Types of prescription and over-the-counter drugs include opioid pain relievers, medicine to treat ADHD, anxiety and sleep medicines, and cold medicine. So we'll go a little bit more specifically into opioids. So opioid subcategories, there's natural opioids, which include morphine and codeine, semi-synthetic opioids, including oxycodone, hydrocodone, hydromorphone, and oxymorphone, methadone, which is a synthetic opioid that is usually categorized on its own, synthetic Opioids, other than methadone, include tramadol and fentanyl, and heroin, which is an illegally manufactured synthetic opioid made from morphine. Over here on the left of the screen, you'll see that drug overdose deaths among age groups per 100,000 residents. You'll see the numbers are quite high in the ages of 25 to 34, as well as 45 to 54. But as you can see, it's really impacting all ages. Prescription drug withdrawal. So opioid withdrawal symptoms: dilated pupils, nausea, vomiting, fatigue, sweating, muscle and joint aches, anxiety, irritability, shakiness, increased heart rate, goosebumps, and yawning. Central nervous system depressants. This is anti-anxiety medication, things like that. Seizures, shakiness, anxiety, agitation, insomnia, overactive reflexes, increased heart rate, high blood pressure, fever with sweating, and hallucinations. And prescription stimulants withdrawal. These are drugs to treat ADHD, fatigue, depression, and sleep problems. So we're going to go a little bit deeper into heroin use as well. So heroin is a natural version of man-made prescription opioid narcotics. So during active use, you'll have a sudden rush of good feelings followed by a crash. You'll have slower movement, chills, nausea, and nervousness. As you're coming down off of heroin, this can occur within a few hours of ingesting. You're going to feel restless, muscle and bone pain, insomnia, diarrhea, vomiting, cold flashes, uncontrolled leg movements, and sometimes this can even lead to death. Symptoms of withdrawal last 36 to 48 hours, but severe cases, which means like long-term use or very heavy use, can last as long as 7 to 10 days. With cocaine, during active use, you may notice rapid movement, thinking and talking, feelings of happiness, full of energy, which is called euphoria, sudden shift of mood to paranoia and anger, and long-term use will result in strong cravings for the drug. During withdrawal, you may experience strong cravings, fatigue, lack of pleasure and anxiety, irritability, sleepiness, and sometimes agitation, extreme suspicion or paranoia, and oftentimes there are no visible physical symptoms aside from those cravings and kind of having to go and try and get more to achieve that same feeling of euphoria. So a little bit about substance use statistics. More than 4 times as many people died from drug overdose than from homicide in the first month of 2021. 96,779 drug overdose deaths were reported from March 2020 to March 2021. So that's in 1 year, close to 100,000 people. Reports indicate a 29.6% increase in the number of drug overdose deaths. Opioids kill more than 3 times as many people as cocaine. Specifically, we're really seeing a high increase in fentanyl overdoses. The national OD rate overdose is 21.6 deaths per 100,000 residents. Among youth and young adults, 15 to 24, the average annual overdose death rate is 12.6 out of every 100,000. Men are 2 times more likely than women to die from overdose. And opioids are the deadliest type of drug, accounting for 71% of all overdose-related deaths. So a few more stats here. 11.7% of Americans 12 and over use illegal drugs. 53 million, or 19.4% of people 12 and over, have used illegal drugs or misused prescription drugs within the last year. Again, I want to point out that this is ages 12 and over that are consistently using the illegal drugs or having misused prescription drugs in the last year. If tobacco and alcohol are included in this statistic, 165 million, or 60.2% of Americans aged 12 years or older currently abuse drugs. So some of the specifics: 139.8 million Americans drink alcohol, 14.8 million have an alcohol use disorder, 58.8 million use tobacco, 31.9 million use illegal drugs, 8.1 million of all drug users have a drug use disorder, and 2 million of those are opioid use disorders. So what are the demographics of individuals that are using drugs or are experiencing substance use and substance use withdrawal? So 22% of males and 17% of females in the US. This is based off of 2021's reporting. 5% in non-metropolitan, which are like the rural counties. 20.2% of people in larger metropolitan counties, which are more like our cities. Manassas Park would be considered more of a metropolitan county. The highest use is in ages 18 to 25, so our young adult coming out of high school, going into that transition period of life. 70% of those who try illegal drugs before age 13 develop a substance use disorder within the next 7 years. So again, 70% of those who try an illegal drug before age 13 develop a substance use disorder within the next 7 years. 47% of people who use an illegal drug by the time 47% of people use an illegal drug by the time they graduate high school. That's almost half of people that are in high school. Within the past 30 days of creating this PowerPoint, it is estimated that 5% of 8th graders use drugs, 20% of 10th graders, and 24% of 12th graders in the United States. In Virginia specifically, 1,547 overdose deaths per year. 2.23% of all deaths are from drug overdose. Overdose deaths increased at an annual rate of 3.24% over the last 3 years. The overdose death rate is 18.3 deaths out of every 100,000 residents. This is 11.59% lower than the national average for OD death rate, and 2.2% of nationwide overdose deaths occur in Virginia. So we've learned a lot about substances. We've learned about some of the statistics and demographics of substance use disorder. I think one thing that we've really covered is that it can affect anyone, and it can affect all ages. So what are some signs of a substance use problem? Signs that you could look out for, in those that you love or in yourself. If you have chosen to use a substance, these are some signs that perhaps it's time to seek help. So lack of interest in things you used to love. Change your friends a lot, if you stop taking care of yourself, spend more time alone than you used to, eat more or less than normal, sleep at odd hours, have problems at work or with family, switch quickly from feeling bad to good or good to bad, and crave or strongly desire the substance. So when you're meeting with a professional and diagnosing a substance use disorder, as mentioned previously, there's the DSM criteria. So again, it's on that continuum from mild to severe. For mild, you're going to meet two to three of their criteria. For moderate, 4 to 5, and for severe, 6+. Some of that criteria includes impaired control, where you're needing larger amounts or over a longer period of time than originally intended, persistent desire to cut down, the inability to do so, a great deal of time spent obtaining the substance, and intense cravings. Social impairment, so failure to fulfill work or school obligations, recurrent social or interpersonal problems, and withdrawal from social or recreational activities. Risky use is recurrent use in situations physically hazardous, continued use despite persistent physical or psychological problems that is likely to have been caused or exacerbated by use. Some pharmacological criteria, so an increased tolerance, so a need for increased dose to achieve the same desired effect. So experiencing withdrawal, this is a syndrome that occurs when blood or tissue concentrations of a substance decline in an individual who has maintained prolonged use. So after going all of this, it is kind of scary and it's a lot to learn, but the most important thing is that it is a treatable disease. They are preventable and treatable. So successful substance use treatment entails medicated assisted treatment, behavioral interventions, and peer support. overview of the treatment process. So early identification, screening, and brief intervention. So the earlier we can do this, the better. This is kind of identifying like, hey, maybe I do need to talk to someone. Let's go see what's going on. A comprehensive assessment is usually what follows. So this is going to determine the extent and severity of the disease being experienced. From there, it's going to turn to stabilization. So this is going to identify if you're detoxing, experiencing withdrawal, ensuring that it's medically supervised and safe. Next would be timely and appropriate substance use disorder treatment. So addressing substance use disorder and co-occurring issues. Substance use is often co-occurring with mental health disorders. So this is likely where you're going to see some of that behavioral therapy and talk therapy to identify some of your triggers and identify kind of what's been going on to lead to substance use. And then from there, continuing care and recovery support. So, you want to help sustain that recovery and maintain family safety and stability. So again, this is kind of a full spectrum of treatment and services. This is kind of geared a little bit more towards families, but this is relatable to substance use treatment as a whole because it is a whole health and wellness functioning. So when you are being treated for substance use, it's going to be important that you are looking at your vocational services. If you need family support, housing and transportation support, you really want to look at those, what we call the 8 domains of wellness, to identify the areas in your life that perhaps you need some more support and perhaps are leading to that exacerbated stress or that whatever the case may be that you're experiencing. So post-treatment expectations, recovery is one day at a time for the rest of a person's life. Relapse is common, but what's important again is looking at it one day at a time and learning from that and moving forward. Ongoing support, kind of if we refer back to the last image, looking at economic, vocational, housing, parenting, medical and social supports, re-engagement in the recovery process should relapse occur, and then supporting recovery, so surrounding yourself with those that are supporting your goals for recovery. An important thing to utilize when speaking about substance use, whether you're speaking to someone else or speaking of yourself, is using a recovery-centered language. So the language we use represents the meanings we have constructed from our experiences. This can prompt attitudes, expectations, and it should always reflect what we call unconditional positive regard. So reflect and think before you speak. What else am I saying? How will someone else read or hear this? Do I have a sense of commitment, hope, and present opportunity, or a sense of pessimism? Do I convey an awareness and expectation of recovery? None of us should be defined by the mental health conditions or psychosocial difficulties that we experience, or by any single aspect of who we are. We should be respected as individuals first and foremost. Addiction is more properly called psychological dependence, a person with a substance use and or mental health condition. So some examples, do put people first. Do say a person with a mental health condition, a person who has been diagnosed with, person who has experienced. Do emphasize abilities. Focus on what is going right. We call this being strength-based. Focus on the strengths and what the positives are. Do use language that conveys hope and optimism and that supports and promotes a culture of recovery. We want to ask what's important to you. What are you looking forward to doing? What do you think what do you think might be steps forward? We really want to empower an individual to seek their recovery. It's their choice and it's individual for each person. So we really want to empower them to do what's best for them. Ask whether the person feels they have been consulted and listened to about their care. Validate a person's experiences. Um, Allow people to find the words and express what they need to say. Sometimes a helpful moment or pause so someone can gather their thoughts is important. Do ask people if they feel ready to make their own decisions or would like to be supported and in what way. Do ask what has been helpful and unhelpful in the past. Do involve people in the development of treatment, care, and support planning. Be mindful of the importance of individual identity to all people, but be particularly sensitive to people's fears of being considered to lack decision-making capacity. So here are some specific examples. So as opposed to saying Kylie is manic, you could say in more recovery-focused language, Kylie has a lot of energy right now. Kylie hasn't slept in 3 days. Sam is experiencing a lot of fear versus Sam is paranoid. Sam is worried that his neighbors want to hurt him versus Sam is delusional. So if you notice the trend here, we're really trying to avoid those labeling words and we're trying to meet a person where they are and validate and acknowledge their experience. If worn out words are used to describe people's attempts to reclaim some shred of power while receiving services in a system that may try to control them, then important opportunities to support a person's recovery will be lost. A person trying to get their needs met may have a perception or opinion different from or not shared by others, and their actions may not be effectively bringing them to the results they want. So again, everyone is different and each recovery path is going to look different. Um, the second section here you'll see in referring to um, Charles. The negative statement is Charles is challenging, difficult, and grumpy man. A more positive recovery-centered way to frame that is Charles is an older person who displays frustrations at times. Again, we don't want to define someone by their mental health or substance use diagnosis or that one piece of what they're experiencing. We want to look at them individually as a whole. So here are some specific resources. So there's Alcoholics Anonymous community-based group for teens and adults. There's a website there, alanonva.com, There's some phone numbers. There's the alcohol and drug helpline that can help you find inpatient, outpatient residential treatment, alcohol treatment referral line, alcohol and drug abuse hotline, and again, the Al-Anon and Alateen, which are available there. The address is here in Manassas on Sudley Road. We also have some crisis hotlines and support. Going through substance use and mental health combinations, especially if they're co-occurring, can be challenging, and at times that might lead to crisis. But there are supports out there for you. There's the ACTS helpline, which is 24/7, CR2, which is 24/7. CR2 is for children, youth, and adults facing mental health and/or substance use crisis. ACTS helpline is crisis intervention for trauma, suicide, sexual assault, domestic violence, and substance use. We also have the Prince William Community Services. They have adult and youth mental health, substance use, and developmental services. Great resource to reach out there, and they can also help direct you to other community resources. Another text or hotline is the PRS crisis link. You can text CONNECT to 85511. The Trevor Project is a 24/7 hotline and text line for challenges LGBTQ plus young people face. You can text START to 678-678. And the crisis text line is for all ages emotional support. Text HOME to 741-741. We also have the NAMI Prince William Helpline, referral and resource support. And on our Manassas Park webpage, you can also find some helpful downloads as well. You're also welcome to reach out to me, again, Sally Starr, Mental Health Program Coordinator for City of Manassas Park. I'm happy to do a brief consultation and identify any needs and link you with appropriate resources. As always, I'd love to hear from you. If you have any follow-up questions, if you have a topic you would like to see in the next month, feel free to reach out and let me know. I'm happy to hear from you. And again, my contact info is here. Thank you so much for tuning in today, and I look forward to seeing everyone next month.